Hi, Denise here. If you're getting this video, it's because I asked you to do a BBT chart. So you got one of these, and what you need to do is fill it out every morning right before you get out of bed. So you're going to need this piece of paper, or if you have an app, you can use the app, a thermometer, a pen if you're going to use paper, of course, and at least 3 hours of uninterrupted sleep. And you also want to try to take it around the same time every morning. So if that's not possible, that's fine. If you can just jot that down, because every hour that you sleep in, it'll actually go up 1 degree. And that way we can just kind of tell the variations and why it's changing. Also, other things that will affect it will be alcohol, or if you were like super stressed, you couldn't fall asleep earlier, or you were traveling. So this is just a variable. It's a really good tool to use, though, because it really helps us see the progression, and it helps us see the underlying conditions of what's going on. So you'll not only be able to see your change, but it's going to help me to be able to help you. Okay, so if you do that every day, that would be awesome. On this chart here, there's also some stuff on the bottom that I would like you to pay attention to, because not only is it a tool for us so that we can help you, but it's also so that you become more in sync with your body. And like, for example, I had a patient who came in who was trying to conceive for a couple years, and when she came in, she started doing her BBT chart. We found out that her fertile mucus wasn't lined up with her ovulation, and that's a significant imbalance that needed to be corrected. And once it was corrected, it took us about 3 months. There's some other stuff going on too, but she was able to conceive. So those are some things that you may not have known if you weren't tracking your cycle, or she wouldn't have known. Okay, so there's other things in here, for example, that are important, like if you have any spotting when you have sex, if you did have poor sleep or alcohol, just kind of jot that down so we make note of that. Or if you were sick, obviously if you have a fever, it's going to be higher, right? Any headaches and breast tenderness. Pay attention to how you feel around ovulation. If you're noticing any symptoms, if you're noticing any fatigue, any pain, an increase in libido. Same thing around your cycle. Are you getting back pain? Are you getting cramps? Are you getting breast tenderness? Are you getting it under the armpits, any headaches, and PMS, because those are all things that we want to know, and we want to correct if it needs to be corrected, so that you don't have to suffer, if you will, or just so that you're more aware of your body. Okay, so I hope that's helpful, and please make sure to bring it in. I actually need it, whether you use an app or not. I need it on this piece of paper, because I need to see the pattern so that I can sit down and compare it and make those changes in either your treatment or in your herbs. So it's really important. Okay, so have fun, and we'll see you soon. Thank you. Bye-bye.